Have you or someone you know ever suffered from an injury and then noticed changes in your sexual health? It's not a topic most people want to talk about. In fact, many men are embarrassed to bring it up. But what if erectile dysfunction isn't just about aging? What if it's about your body's way of telling you that something isn't functioning properly? Today, we're going to discuss why some men may develop erectile dysfunction after an injury, including possible links to traumatic brain injury, PTSD, spinal injuries, pelvic injuries, chronic pain, medication interactions, hormones, and more. We'll also discuss what the research shows and what it doesn't show, and when you should seek a medical evaluation. Disclaimer: this video is for educational purposes only. It's not medical advice, and it does not create a doctor-patient relationship. If you are experiencing erectile dysfunction or other health concerns, please consult a qualified healthcare professional. First, let's get something important out of the way. I'm not saying every injury causes erectile dysfunction. And I'm not saying every person with erectile dysfunction has suffered a traumatic injury. What I am saying is this: erectile dysfunction depends on multiple systems working together. Your brain, your nervous system, your blood vessels, your hormones, your mental health, your sleep, and even your musculoskeletal system. When trauma disrupts one or more of these symptoms, problems can develop. Direct physical injuries. Let's start with the most direct related causes: pelvic trauma, pelvic fractures, or other significant injuries involving the pelvic region. The pelvic contains important blood vessels and nerves that play a crucial role in sexual function. In fact, some strong research links trauma to erectile dysfunction involving pelvic injuries. When these structures are damaged, they may disrupt blood flow, nerve flow, or both. This is one of the most well-established trauma-related pathways to erectile dysfunction. Spinal cord and nerve injuries. Next, let's talk about the spine. The nerves responsible for sexual function originate in the spinal cord, and they're in the pelvic region. Serious spinal cord injuries have a well-established association with sexual dysfunction. But even outside of major spinal cord injuries, certain neurological conditions may play a role. This is particularly important when a person also experiences numbness in the legs, tingling, weakness in the legs, or other neurological changes. And remember, not all low back pain causes erectile dysfunction, but certain conditions involving the nervous system may affect both. Pain location does not always equal the source of the problem, and sometimes erectile dysfunction may be one of several causes. Something else, the nervous system, if the nervous system isn't functioning correctly, that can occur. Traumatic brain injury. Now let's talk about, this is something also known as TBI. Sometimes people may never consider that the brain can have something to do with erectile dysfunction. Researchers have actually looked at whether traumatic brain injury may be associated with erectile dysfunction. In one large population-based study involving thousands of individuals, people with traumatic brain injury were found to have a higher risk of developing erectile dysfunction compared to those without a traumatic brain injury. Now, that doesn't mean every concussion or TBI causes erectile dysfunction, but it does suggest that there may be an important connection worth understanding. The brain plays a central role in desire, arousal, mood, sleep. It's very important and crucial that there not be any injury or issues that are causing disruption of any of these functions. Hormonal regulation and overall nervous system function after traumatic brain injury. Some people experience brain fog after a TBI, fatigue, mood changes, sleep disturbances, and hormonal changes. All of these may potentially affect sexual function. You don't have to have a pelvic injury to experience dysfunction after a trauma. The brain may play an important part too. It's definitely worth understanding more about. Like I said, the brain may play an important role too. Move the screen, yeah. Post-traumatic stress, or PTSD disorder, and anxiety after a serious injury or car accident is another factor, and some people develop anxiety, fear, chronic stress, or post-traumatic stress disorder, PTSD. This isn't just theory. Multiple research studies have reported associations between PTSD and sexual dysfunction. One large cohort study found that individuals with PTSD were more likely to develop erectile dysfunction than those without PTSD. Other systemic reviews have also reported higher rates of sexual difficulties in people suffering from post-traumatic stress. When you think about it, it makes sense, right? The body's stress response is designed for survival, not intimacy. When the nervous system is stuck in a state of constant alertness or fight or flight, many aspects of health may suffer, including sexual function. PTSD doesn't just affect your mind. It may affect your sleep, your relationships, your recovery, and your sexual health as well. Chronic pain, this is something that can affect sexual function as well. Chronic pain is another factor and should not be overlooked. If every movement hurts, and if you aren't sleeping well, and if you're worried about recovery, you can't exercise like you used to, that can create a cascade of effects throughout the whole body. Intimacy may become more complicated and painful. Energy levels may decline. Mood may change. And all of these factors may contribute to sexual dysfunction. Next, medications and how they interact with sexual dysfunction. Another important consideration is medication after someone has an injury. Some people may be prescribed pain medications, antidepressants, anti-anxiety medications, or sleep medications. Some of these medications may have sexual side effects. They may interfere with your sexual health, and they may cause or contribute to erectile dysfunction. That doesn't mean you should stop taking them, but it does mean it's an important conversation to have with your healthcare provider if you notice any changes. Next, hormones and sleep. Let's not forget about hormones. Sleep and recovery are so important to many functions of your body. Poor sleep can impact hormonal balance, chronic stress can impact hormonal balance, and certain traumatic events, brain injuries, may affect the system that helps regulate your hormones. And this is one reason why erectile dysfunction is often multifactorial. Pelvic floor muscles. The pelvic floor is a group of muscles at the bottom of the pelvis that act like a supportive hammock. These muscles help control the bladder, bowel functions, and support important organs and play a role in sexual functions and erections. After an injury, the pelvic floor muscles can become tight, painful, or dysfunctional, just not working. When that happens, it may contribute to pelvic pain, bladder issues, and in some cases, sexual dysfunction. One of the most overlooked contributions may be pelvic floor injuries. And in fact, researchers have studied whether pelvic floor rehabilitation may help certain men with erectile dysfunction. This makes sense when you consider that important role that the muscles, the pelvic floor muscles, play in normal function. If someone also is experiencing pelvic pain, low back pain, hip pain, urinary changes, or painful ejaculations, the pelvic floor may be a part of the discussion with your doctor. If you look at the medical literature, the most consistent, reported, trauma-related contributions to erectile dysfunction include pelvic trauma, spinal cord injury, traumatic brain injury, post-traumatic stress, and in many cases are not just one of those factors. It's several factors occurring at the same time. Here's some red flags if you have erectile dysfunction along with any of these. Loss of bowel or bladder control, saddle numbness, significant leg weakness, progressive numbness, or other major neurological changes. Seek medical attention immediately. These may indicate a more serious underlying condition. And if there is one thing I want you to remember from this video is that erectile dysfunction after an injury is often multifactorial. It may involve the brain, the nervous system, the spine, the pelvic, the blood flow, hormones, pain, stress, medication, interactions, or a combination of several factors. Listen, the good news is that many of these factors can be identified, evaluated, and addressed. So if you're experiencing an injury and have noticed changes in your sexual health, don't ignore it. And don't be embarrassed to talk about it to a healthcare professional. Listen, if you found this video helpful, please like, share, and subscribe. Many of our viewers that watch these videos don't subscribe to the channel, so make sure you smash that like button and subscribe. And if you have any questions about injury, recovery, or would like to learn more, feel free to contact our office. And again, thank you for watching. See you in the next video.